My name is Elizabeth Hastings, and in this presentation, I will be telling you about the effects that Spinraza has on spinal muscular atrophy. Spinal muscular atrophy, also known as SMA, is an autosomal recessive disease, which means that they must inherit a recessive allele from both mom and dad in order to be affected by this disease. It affects a gene on chromosome 5. This gene is responsible for making a protein that maintains the function of motor neurons. As you see in my little diagrams that I have drawn, pre-symptomatic, the motor neuron is fully intact. At onset, the degeneration begins, and the sufferer will experience fatigue and weakness. Later in the disease progression, the sufferer will have weakness and atrophy of muscles in the body, and it comes to a point where there's a total neuron loss, which the sufferer will no longer be able to use the muscles that these motor neurons are associated with. Over time, the motor neurons will degenerate throughout the body, which can incapacitate these sufferers. There are 4 types of SMA. The first one is called Werning-Hoffmann disease, and 60% of all of these cases are this kind. It is the most severe. The onset is before they hit 6 months. They're unable to sit without support. They have trouble breathing, coughing, and swallowing. Most of the sufferers with this do not survive past age 2. The second type is Dubowitz syndrome, and it is 20 to 30% of all cases. The onset is typically from 6 to 18 months. The patients are unable to stand or walk without support. They may gradually experience the trouble breathing, coughing, swallowing. With early diagnosis and care, people with this type 2 can survive well into adulthood. Type 3 is Kugelberg-Welander disease. So all of these types affect that protein that functions to help the motor neurons. The type 3 is 10 to 20 cases. The onset is greater than 18 months. So they're able to stand alone and walk, but they may over time lose this ability. They may have slight tremors and muscle weakness. People with this typically have a normal life expectancy. And the final type is, it doesn't have a name, but it is the late adulthood onset of SMA. They lose their mobility over time. They may have slight tremors and muscle weaknesses. It can often be confused with other diseases, so genetic testing must be done to know that it is SMA. People with this typically have a normal life expectancy as well. It's just known as type 4 of SMA. Okay, so gene therapy, which is what Spinraza drug is a branch of science that deals with manipulating the expression of genes in order to benefit the patient. So scientists can do this in 3 ways. They can replace a diseased gene with a healthy one. They can inactivate a disease-causing gene, or they can introduce a new or modified gene. So Spinraza works by forcing the body to make more of these functional motor neurons that they have lost or digressed early in the disease. It does so by inserting an antisense oligonucleotide into the body through an injection. These injections are given at day 1, 15, 30, and 60, and then after that they have to get maintenance injections every 4 months. So here's a drawing that I did on how it works. So the antisense oligonucleotide is the Spinraza. It's injected. The cell will uptake the oligonucleotide, and it will travel to the mRNA, where it inserts a message to code for those motor neurons to be produced. It is helping greatly. It's showing promising results. Since 2016, which is when it started being used, patients are having the short-term success with this drug, along with other therapies. Long-term effects are not found yet because there have not been enough studies done with this, but they are in the works. Hopefully that this can help a lot of people with the SMA. Any age can take this drug. It's not limited to the adult or the babies. There are other drugs out there for SMA, but Spinraza is one that is showing the more promising results at this time. Thank you so much.